Welcome to WCCL Foundation's short tutorial on few clinical aspects of music. We have launched a course called Certificate in Clinical Musicianship, and as part of that, we are offering some free videos. I'm here to introduce a very simple instrument which may be very useful for all arts-based therapy practitioners, all people who are interested in applying music in clinical practice. I have here a small pad. It's called an electronic drum pad. And the beauty of this is that it comes along with two pedals. Okay. Now these are sustained pedals. Now, one of the protocols in clinical musicianship is how rhythm can affect motor skills. The underlying theory being that auditory cueing can improve muscle movement. And one example of that is, suppose you're working with children with cerebral palsy and you want to improve some movement, maybe upper limb. If you play this with a song, la 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 la, now your job is to skillfully place this along a grid of movement that you want, and then of course give a nice song which they like, and you have motivation and you have a very doable action. These come with two pads, so you can make people move, even for those with, say, working with traumatic brain injuries. So if you're doing physical rehabilitation, this also works well with actual gait rehabilitation, walking. So if I want to put all my pressure on one foot, I lift and press the pedal with the other foot. Da, 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 da. Usually we work with a metronome, a simple device which gives a click. And we use this at different tempos to facilitate this movement. Another good use of this electronic drum pad, is you can create grooves. Right? So now if you have a sequence like you can make this more and more complex. Apna time aayega. Or you can have it very simple. There are a couple of options for different sounds. So you can do call and responses. You can play with your hand. Just a touch is enough. Get a very loud sound. If you're playing with sequences in the cognitive domain, you have like ability to structure this sound pattern. 1, 2, 3, 4. 1, 2, 3, 4. In the same spatial pattern. You also have say if you're working with referencing, say for example, that's if you're working with people who are having depression, and you want to reference the feeling of depression, you can create a groove, or you can get them to, you can empower them to be creative with this. Set up a groove. I'm feeling down, I'm feeling down. Head heavy, body tired, feeling down, 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 down. So, other than my favorite instrument, this is a very useful instrument to have. There are lots of protocols that we have in clinical musicianship. For example, one of the most important ones is to do with the fact that music affects the HPA axis. So it affects stress and cortisol levels in a positive way, reduces cortisol. And the way that happens is because one of the protocols is music and HPA axis, or music, which is the hypothalamus pituitary adrenaline axis, and we are working with the limbic brain there, and the fight and flight response, which is extremely aggravated in some people, that can be brought down or calmed just by playing a groove like hey ya na 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 na, hey ya na 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 na, hey ya na 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 na, hey ya. When I'm doing this, I can't think of anything else. So, if you're interested in pursuing this kind of simple, easy music, which can be directly applied with all various special needs populations, I would highly recommend that you join our course, Certificate in Clinical Musicianship by WCCL Foundation. Thank you.